I'm going to demonstrate thoracic extension exercises, starting with extension and lying, which is very commonly referred to as a McKenzie press-up. And a McKenzie press-up recruits motion up to T5. And then if you want to get total extension coming from the thoracolumbar to the lumbosacral region, you want a second technique that then gets into the mid-thoracic spine, and then a third technique that gets you up into the higher levels. So we work from the bottom up, because as we raise our arms up, right, if I'm going to reach for something overhead, the extension starts in the lower back, goes to the mid-back, to the upper thoracic spine. Scapular upward rotation with any overhead activity starts with extension from low to high. So if you're in a therapeutic environment, you want to combine from the bottom up, things of that nature. So Kelly, who's a doctoral student from Elon University, is going to demonstrate press up, which is an extension and lying. A couple other little tips with extension and lying that we have found through EMG work is that if you watch your patients and their feet are in external rotation, and Kelly comes up and does a press up and comes all the way up, walk up through there's way too much gluteus activity going on, so it becomes an active extension, which you want to make this passive. So you want to make sure that your patient has everything wide and in, and the hands are up there, and as she obviously has hypermobility here, so just want to make note of that. I don't know if this patient, Kelly, requires extension, but you've seen a lot of folks that come off and their ASIS comes off, and Saunders did some work back in the 70s and just looked at a way to measure your lack of extension, and 0 to 2 being normal, 2 to 4 is moderate restriction, and somebody's ASIS that comes off the plinth by 4 inches is pretty stiff. So you want to monitor that and then do some manual therapy segmentally, or some towel overpressure or hand overpressure. Second exercise, Kelly, come on up here, this is going to be our chair extension. The best way to do this is angle it like so. So now you're going to sit off the very edge, and my size 13 comes right over the top like that. The hands go behind your head. Bring yourself in there nice. The patient's going to do the work. And where did we lay you off? About 5. So I'm going to go down about 2 or 3 levels. This little pisiform fits perfect right in the inner spinal space. This comes right up underneath, kind of give her a little hug there, and then she comes up. Again, she's very flexible, but just for demonstration purposes, you're going to find a lot of patients that go to about here, and you got to work that up. Now, you're going to go with number 3. Hop up for a sec. Number 3 is going to be slide the chair back. Patient gets down. Patient goes here, here, and gets into the position like they're going to wait for their mom and dad to come pick them up in 2nd grade. So you get the head down on the forehead. You kind of sneak up underneath here. I got my fingers are in the articular pillars and kind of show that. Got spinous process, and then drop right off the side. My feet are in a diagonal stance, which is huge because you're going to use your quadriceps. Make sure you work out at least 3 days a week. And then you're going to come up in that. You could also add a little bit of T-spine rotation. Come back down, hit about, I don't know, 20 seconds or 10 reps, whatever you like to do, depending on how you feel that day. And you're just going to keep working from where you left off. So if I started with extension and lying, it takes it up to 5, drop it down so you get a little bit of overlap, and then that kind of works it up to the, T2 goes to the spine, the scapular. Put your hands in that position and get that entire extension of the thoracic and lumbar spine.